This is WFYI News Now. It's November 21st, and I'm Abriana Herron. On today's show, school choice expansion emerges as a potential priority for lawmakers in the upcoming legislative session. The ruling comes in for an Indiana physician in his case against Fort Wayne-based Lutheran Medical Group. And the government has added fluoride to the water system since the 1940s. It's been successful at reducing tooth decay and cavities. So why does Trump's nominee for the Department of Health and Human Services want to remove it?
It's really rare for someone who has influence at the federal level to take a stand on an issue that directly affects oral health.
Those stories coming up. But first, Indiana's infant mortality rate improved in 2023. Indiana Public Broadcasting's Abigail Ruman reports provisional data from the Center for Disease Control and Prevention shows Indiana is no longer among the 10 worst states.
Indiana now has the 13th highest infant mortality rate in the country, according to a CDC report. This is the first time since 2019 that Indiana hasn't been in the bottom 10 states. This is also the first time since 2019 that Indiana saw a decrease in the infant mortality rate. The rate dropped from a little more than 7 deaths for every 1,000 live births a year earlier to 6.5 in 2023. On a national level, the rate held steady from the previous year at 5.6. There was no significant change among racial and ethnic groups, but Black infants continued to die at the highest rate, more than double the rate of white infants. For Indiana Public Broadcasting, I'm Abigail Ruman.
Indiana's House and Senate met Tuesday to ceremonially start the legislative session, when bills are written and debated by elected officials before passage. From WFYI's Education Desk, Rachel Fredette reports that lawmakers have not yet revealed what they plan to do, but school choice expansion has emerged as a potential priority.
Governor-elect Mike Braun pushed for school choice expansion during his campaign. Now Republican leaders at the State House are poised to take up that controversial issue. Here's House Speaker Todd Houston.
Well, we're always looking about how we can expand school choice to more families, and I'm sure that'll be a discussion during the session.
Senate President Pro Tempore Roderick Bray says school choice expansion is definitely a topic for his chamber. An idea from last year to shift oversight of choice programs to the State Treasurer's Department is not yet outlined in legislation.
I haven't seen any versions of bills at this point in time, but I have heard some talk about that.
The legislative session begins in January. Representatives and senators have until mid-January to file bills. I'm Rachel Fredette.
A judge ruled in favor of an Indiana physician in his case against Fort Wayne-based Lutheran Medical Group. WFYI's Farah Yusri reports the judge found that Lutheran breached the contract in that it cannot enforce its non-compete agreement.
Dr. David Langford is a pediatric intensivist. He takes care of the sickest of the sick patients. He worked for Lutheran for several years. Then in 2022, the hospital let some physicians go and shifted their job duties to Langford,
which meant more patients to see, more consults to make, more notes to write, more discharges, more admissions.
After months of litigation, a judge ruled that Lutheran breached its contract with Langford and that they can't enforce any part of it, including the non-compete clause. That non-compete would have barred Langford from practicing medicine within a 30-mile radius of any Lutheran hospital or office. The judge also ruled that the non-compete was overly broad and restrictive. Langford is also potentially entitled to monetary damages, according to the ruling. The amount of damages will be determined at trial. I'm Farah Yusri.
To learn more about this story, go to WFYI.org. And for our final story today. When you pour a glass of water from your tap in the United States, it's likely that glass has a small therapeutic dose of fluoride. The mineral has been added to our water for roughly 80 years to reduce cavities. But that might change. Trump's pick to head the Department of Health and Human Services has said he wants to remove fluoride from U.S. water systems. Side Effects Public Media's Ben Thorpe says some health experts are worried, while others say emerging research may back up the effort.
Donald Chi was surprised to hear fluoride had become part of a U.S. presidential campaign.
It's really rare for someone, who has influence at the federal level to take a stand on an issue that directly affects oral health.
Chi is an associate dean for research in the School of Dentistry at the University of Washington and says that fluoride has been a staple of oral medicine for roughly 80 years.
So every time you drink tap water that's fluoridated, you get that protection from cavities.
It's likely water fluoridation has saved many of us from multiple painful dentist visits since the government added it to the water in the 1940s. It was so successful that the Centers for Disease Control and Prevention dubbed it one of the greatest public health interventions of the 20th century. Now, roughly 200 million Americans receive fluoridated water from a community water system. So, what would happen if fluoride was removed? If you brush your teeth twice a day with fluoride toothpaste and don't eat a lot of carbs and sugars, you might not notice a big difference. But for many people, that's not the case.
Particularly, it makes a difference for people who have difficulty with toothbrushing.
That's James Dickinson. He's a professor of community health sciences at the University of Calgary in Canada.
And it makes a difference for everybody at all ages.
His city voted to end the use of fluoride in drinking water. It was a natural experiment of sorts, and the result was clear.
There's a steady increase in the amount of rotten teeth, and that means children who have multiple fillings, children who need general anesthetic to have major tooth surgery.
But emerging science has begun to indicate some risks associated with fluoride at high levels. Earlier this year, a federal health agency released findings from an 8-year review of studies mostly outside the U.S. The agency concluded that it had moderate confidence that fluoride at levels roughly double those found in U.S. water systems could be associated with lower IQ in children. The American Academy of Pediatrics pushed back against this review and questioned its validity. But that review is not the only report to show such an association. Ashley Mullen worked on one of those studies. She's an epidemiologist at the University of Florida, and she says
the concentration needs to be reduced in community water or that the practice needs to be ended altogether.
Mullen studied urine samples from pregnant women in Los Angeles. She looked at total fluoride exposure, not just from drinking water. Her study found an association with negative impacts on children's behavioral health.
And so this is an association that we observed. It doesn't necessarily mean that it's causal, but it is consistent with numerous other studies published in North America.
Mullen says the research is increasingly pointing to a trade-off between health risk and health benefits. But most dental experts say it is far too soon to make changes to public health policy. Chi, with the School of Dentistry at the University of Washington, says there would be clear consequences for removing fluoride, and we need more studies to determine how much risk is posed by the dose of fluoride added to water.
Rarely is one study going to definitively tell us all the answers we need to make, a decision. So science is cumulative.
In the meantime, Chi says, the onus will be on public health experts to explain the latest science that recommendations are based on to the American people. For Side Effects Public Media, I'm Ben Thorpe.
That's all for today's episode of WFYI News Now. Our podcast is produced by Drew Daudelin, with support from the news team at WFYI and public media journalists across the state. Our news director is Sarah Neal-Estes. Kendall Antron produced our music, and I'm your host, Abriana Herron. If you like today's episode, remember to subscribe and share, and follow WFYI on Instagram, TikTok, Facebook, and YouTube to check in on our newsroom throughout the day. Thanks for listening. We'll be back tomorrow.